Imagine your brain as a superhighway of electrical signals, perfectly coordinated to help you think, move, and feel. What happens when a major event disrupts this intricate network, creating unexpected detours and roadblocks? This can sometimes lead to new electrical pathways forming, changing how the brain functions. Yes, a stroke can absolutely cause epilepsy. In fact, a stroke is one of the most common causes of new-onset epilepsy in adults, particularly in older individuals. When a stroke occurs, it damages brain tissue, and this injury can leave behind a scar or an area of abnormal electrical activity that may lead to seizures. The fundamental reason a stroke can lead to epilepsy lies in the nature of brain injury itself. A stroke, whether ischemic due to a blocked blood vessel or hemorrhagic due to a ruptured one, deprives brain cells of vital oxygen and nutrients. This cell death creates a lesion or scar tissue within the brain. This damaged area can become hyperexcitable, meaning the neurons there are more prone to firing abnormally and excessively. This abnormal firing can then spread, triggering an epileptic seizure. Over time, this repeated abnormal electrical activity can reorganize the surrounding brain tissue, establishing a permanent seizure focus, which is the definition of epilepsy. Understanding this connection helps you appreciate the importance of quick action and follow-up care after a stroke. While you cannot prevent the initial stroke injury from potentially leading to epilepsy, you can work closely with your medical team. This involves careful monitoring for any seizure activity after a stroke and discussing any unusual symptoms you experience with your doctor, such as sudden jerking movements, periods of confusion, or unexplained sensations. These could be subtle signs of a seizure. Recognizing these changes early is key to managing post-stroke epilepsy effectively. It is important to remember that not everyone who has a stroke will develop epilepsy. The risk factors can vary, influenced by the location of the stroke in the brain, the size of the damaged area, and whether the stroke caused bleeding. Strokes affecting the cerebral cortex, which is the outer layer of the brain responsible for many higher functions, are more likely to result in epilepsy. The window for developing post-stroke epilepsy can also be quite broad, sometimes appearing weeks, months, or even years after the initial event. This delayed onset underscores the need for ongoing vigilance. Ultimately, recognizing the link between a stroke and the potential for epilepsy empowers you to be an active participant in your health. By staying informed about the risks, communicating openly with your healthcare providers about any changes or concerns, and adhering to your post-stroke care plan, you are taking proactive steps toward managing your overall well-being. This knowledge allows you to better understand what to look for and when to seek guidance, ensuring that you can navigate your health journey with confidence and support.